What is most popular?
All right, so the common ones would be liposuction.
So liposuction is removing from...
Yeah, so liposuction is removing fat from areas where you don't want it. So we use a machine called a liposuction machine. Through a very small hole in your skin, we stick it through, and then the machine sucks the fat out.
Sounds so painful.
I prefer to call it body contouring.
Okay.
Because it's not just sucking fat out. I've had a few who want like fuller labia. I want a more youthful looking vagina, so we give them that.
That's a fun job. I want a fuller looking vagina.
Yeah, it is. It's interesting work. There's also what we call the G-spot augmentation.
Talk to me. What is the G-spot augmentation?
G-spot augmentation. So yeah, there are men who do come in for nose jobs, men who come in for liposuction. I've seen men come in for wanting bigger penises.
Oh yeah, what the? I'm actually going to ask that.
Yeah.
You do that?
I've seen it twice so far in my career.
Pause.
Like in Kenya?
Yeah, in Kenya.
Interesting.
Yeah, in Kenya. So there are men who do want that.
And is it achievable? Is that something that...
It's achievable. You can get, let me say, modest results. So he got approached by an adult who wanted to change their gender. All right. Let me stick to very general terms. Okay. So that I'm not sure where I'm not using the terms correctly. But you will forgive me if I do.
I forgive you. I don't even... I know just basic sciences, male and female.
Yeah.
And yeah.
So the patient approached him and like, oh, can you do the surgery?
So this is a man? Male?
Yeah, this is a male who wanted to transition to
A woman.
Right? Media has made it so hard to justify the things that we do and how we do it. Because a lot of the things that people have interacted with online are the bad side of it.
Oh,
So
interesting.
a lot of people have interacted with bad Botox. So for example, I've had Botox.
Oh, really?
But I don't know if you'd be able to tell.
Where?
Because it's not bad Botox. I've had good Botox.
Where have you had it?
On my face.
Okay.
Right?
What is it?
It's currently wearing off. So what Botox is...
I've had, I don't know, situations like when people get like boob jobs, there's like leaking and boobs exploding. Is that a myth? Is it?
It has happened.
Jesus! Oh my God!
And
And
spontaneously exploding. There's once I saw a clip that was doing the rounds of
Yeah.
a lady who was in an airplane, and the airplane, I think, was taxiing and
Took off, and Connie could feel it. Her luck was changing. What she really felt was the stirring of air bubbles and other gases trapped in her new knockers. Her lovely lady at an alarming rate. They grew to ridiculous proportions.
went up high altitudes, and all of a sudden her breast started getting bigger and bigger and bigger. No, that doesn't happen.
Hey, welcome back. It has been a while since I've done a career story. Yeah, we live in a world where, like, if you kind of don't like a part of your body, like, you have a few options. You can figure out how to, like, change your diet. You can go for, you know, plastic surgery. You can swallow some pill. So today I will be talking to someone who does reconstructive surgery and plastic surgery. I think they piqued my curiosity with a lot of their posts they do on LinkedIn. Yeah, so without further ado, I'll just welcome. And by the way, I've known this guy since he was a baby. So he's now like a doctor. So welcome, Doctor.
Thank you.
John Paul Ogallo.
Thank you. Thank you. So my name is Dr. JP Ogallo. I'm a Nairobi-based plastic, reconstructive, and aesthetic surgeon, or short form, just a plastic surgeon. I am periodically also a proud Kenyan. Yeah, that's pretty much the long and short of it all.
Tell us about
Yeah.
periodically being a proud Kenyan, because I'm kind of like that, even throughout my band. Like now, I'm Tanzanian. I'm done with this country.
I mean, it's tough to just consistently be a proud Kenyan, because I was telling somebody the other day that some of us, or a lot of the people that are around me, friends, family, are in the prime of our careers,
And
so to speak, or at least they're just picking off, and they're and for the next 10 years, and I don't want to get political, it doesn't look like it's just going to be an easy ride or a very comfortable ride. So it's tough times.
It's tough times.
It's tough times.
We
So
also-
periodically proud.
Yes, we're tough people as well.
We broke the world record.
Oh, he's gonna crush the world record pound! Oh my goodness! Oh my goodness!
In the marathon. So
Yeah,
I was
okay.
proud
Yeah.
a few days ago. Now I'm back to where I am.
Cool. Maybe we can walk through how you got into being a medic. Like
Okay.
what passion was it? Was it just our parents who told us we should either be like lawyers, doctors, or engineers?
Yeah.
Because your sister, who's a good
Yeah.
friend, is a lawyer. You're a doctor.
Yeah. Okay. I found that a lot in like a lot of the people that I went to school with, that they were pushed towards certain careers.
Yeah.
I mean, we were fortunate enough. Our parents never pushed us towards anything. They were more like, okay, so what do you want to do? And I'm like, I want to go to med school. And here it is.
Yeah.
But how I ended up in med school, or how I decided to go to med school, I think growing up, the only two things I ever wanted to become was, one, a priest.
A priest, you.
Yes, a priest. A priest.
Because I think I know you, man.
Well, things changed along the way. That's when I looked at it like, no, maybe I just need to become something else that's close to being a priest, but not a priest. So for those, I guess, who don't know, my name is John Paul. So I was named after the Pope. So I guess sometimes when you're named after something, you tend to be inclined towards going towards that.
Yeah.
And even growing up, I was always reminded of his character and the things that made him such a great pope.
Yeah.
And I always found it such a beautiful thing. I'm a Catholic, and I've always found Catholicism and the traditions behind it very beautiful. So I always just grew up just admiring all this stuff.
Yeah.
So very early on, I did want to become a priest. And then, you hit puberty and, it changes the landscape a little bit. So it didn't seem like it was something that was sustainable. And one of the things that came very close to that for me, in my eyes, was becoming a doctor. It just always fit in with me. And I've honestly never been a person who wavers between like decisions.
Oh, you're very decisive.
I'm very decisive. So I said, let me do medicine. Then go
ahead and do it.
So
Love
it was never medicine, engineering. No, I want to be a singer. I want to be a fireman. No, I said, okay, I can't become a priest, so let me become a doctor.
Yeah.
And boom. So how do I get there? What do I need to do to get there? Okay, so you need to get this grades. You need to go to this school, and then
Yeah.
So that's how I initially became a doctor.
Yeah.
Okay, and then at some point now came the whole plastic surgery thing.
Yes. Yeah.
Yeah. So that came about in my third or fourth year of medicine.
Okay.
So during at that point in med school, so you normally do, it's called an elective. Mm-hmm. Okay. So you pick a hospital, locally or internationally, and you get attached there for 1 month in a particular department. And you just it's just to expose you.
Yeah.
And just to see what's going on out there. So I went to a hospital in Johannesburg. Okay. It's called Chris Hani. Mm-hmm. At the time, it was the largest hospital in the world.
Oh, wow.
Yeah. And at that time, I was leaning already towards surgery. And it was a fantastic hospital in the sense that they had very high volumes of surgical cases.
Okay.
And a lot of trauma, because Johannesburg is a very wild place. So you're talking accidents and stabbings and shootings and all that kind of stuff. So their trauma unit is like nothing I've ever seen before.
Yeah.
So I did a rotation there, And during the rotation, I was in the operating room. I popped in. I was walking through the operating room, and I popped in, and I was like, there was a case going on in one of the theaters, and I popped in. I was like, oh, so what's going on here? And it was a patient who had a cancer somewhere on the back. So I watched these guys, they were removing the cancer. So those are oncological surgeons. So
What does a
oncological
cancer
surgeons.
look like? Sorry with my dumb question.
What does a cancer look like? It looks like a big fungating ball of cauliflower.
Oh.
Yeah, coming from some part of your body.
Oof.
That particular cancer looked like that.
Okay.
So they had these oncological surgeons who basically come in and remove it.
Yeah.
So they came in and removed it, and they didn't close the patient up or put anything on there. They just removed their gloves and kind of left. And I'm like, oh, so what's going on here?
Yeah.
So 2 seconds later, another team comes into the room.
Oh, wow.
And they start putting on their gloves and they jump in, and I'm like, who are these guys?
Yeah.
So I was like, oh yeah, these are the plastic surgeons. So what are they coming to do? Oh, they're coming to close that big hole these other guys have created in their back. So I was like, oh, how are they going to do that? That thing is massive. And I just watched them just out of nowhere move things around the human body and eventually manage to close up the thing. And I was absolutely taken aback.
Yeah.
Ever since I was a kid, I've had this thing about fixing things.
Okay.
I always like fixing things and problem solving.
Yeah.
I like those things. Give me any one problem, I'll give you 10 solutions.
Yeah.
Within a minute. They may not be good solutions, but I'll
there's
give you
something,
solutions.
yeah.
And I find so much joy in doing that.
Yeah.
And so reconstructive surgery came to me very naturally.
Yeah.
Right. So you'll even see on my socials, I call myself Rekebisha.
Yeah.
Because I like fixing
Oh,
things.
that's what
So,
your handle means.
Yeah.
After
That's
25
pretty
years, I
much where
get
it came
it.
from.
Okay, cool.
Yeah, so plastic surgery came very naturally to me after that because it's all about fixing things, and not just fixing things, but fixing them well and using your imagination. There's a lot of imagination and creativity involved in the art of plastic surgery.
I
I call it an art because that's what it is, and it's also very technically demanding and requires a lot of finesse and a lot of know-how.
Yeah.
I might be biased, but I find it, and some of my colleagues may hear me say this and squirm a little, but I think it is the pinnacle of surgical practice is plastic surgery.
Yeah. I mean, I can imagine because if for example, you had a patient who's gone through an accident and as you say, there's trauma and your face has been ruined or something, and I can imagine you'd love to get it fixed because that is part of the healing. So I mean, I'm not a doctor, but I can imagine how that is very magical, and fulfilling.
Yeah.
How do you balance between the reconstructive work and I'll call it vanity, where someone comes to you and says, I want my tummy tucked, I want a Brazilian butt lift, I want a boob job. How do you balance that?
Okay. I get this question a lot. So look, like any other thing or any other skill that you build and create over time, I'm first and foremost a professional, right?
Okay. Yeah.
So my job is to solve the problem. Okay, whatever problem is presented in front of me, provided I have the skill and capacity to sort it out in a safe manner, and it is my job to provide a solution for it. So that said, I never discriminate between patients who are coming in for aesthetic surgery or the vanity work and reconstructive surgery.
So you can't judge.
No, I never judge because again, I've been in the practice for some time, and I feel sometimes the patients who come in for aesthetic surgery, they're very misunderstood.
Okay.
And when you have conversations with some of these people, you would understand how debilitating some of these perceptions of their own selves, how that affects their lives. For example, you'll meet people who are in their 50s and who've just never comfortably been able to do something simple as dating.
Dating.
They can't bring themselves to go on a date with a man because of how they feel they look.
Okay.
or how they would look with their clothes off, those kind of things. So to you, it may seem like, you don't need this, you look beautiful,
Yeah.
and which may be true.
Yeah.
But there's something about it that they don't like, and you have to respect that opinion about them.
Okay.
Now, I would rather be in a position where I can deliver to them what it is that they want.
They want.
Within, of course, the confines of what is possible and what is safe. And I'd rather they come to me to get it done
Then to get.
than to get it done botched somewhere else.
Yeah.
And that's now how you end up with all of these horror stories.
Okay.
Yeah, but by and large, right now, a lot of the work in Kenya tends to be more of reconstructive.
Okay.
Yeah, but
Also, really, it is more reconstructive.
yeah, it's more reconstructive. But again, another reason why I would say that is because plastic surgery hasn't historically been very common in Kenya.
Yeah.
And now that there's more of us in the industry, it's becoming a lot more common, and people are seeing that, okay, this can actually get done here in Kenya.
Yeah.
And there are good guys around who are well trained,
Yeah.
and they can deliver this to me. So the numbers are, starting to go up, because previously patients would fly to places like India,
Thailand.
Brazil, Thailand, Dubai for these procedures when
Yeah.
you can actually just get them done.
Yeah. I'm curious, how much is like say a boob job?
How much is a boob job? I'll give you a rough estimate.
Okay. Depends on the size.
It depends on a bunch of factors.
Okay.
But to answer your question directly, anywhere probably between 600 to 800,000 shillings, you can get a boob job done in Kenya. They're not very common in Africa because...
You're happy with our boobs?
Yeah. Yeah. I mean, African women tend to be fairly
Beautiful.
more blessed and beautiful as well.
Yeah.
So on the side of boobs, we tend to get more of the breast reductions as
Yeah,
opposed
for
to
sure.
people wanting, bigger boobs.
What's that condition with like women who have like really...
Gigantomastia.
Yeah. Oh, okay.
Gigantomastia.
And that makes sense.
Yeah, it's very common.
Yeah.
Again, a very misunderstood
Yeah.
affliction, if I can call it that.
Yeah.
Yeah.
Must be hard. I can imagine they get loads of back pain and just everything's difficult. Like,
They do.
Yeah.
And the thing is, culturally, people are like, okay, I mean, you have big breasts, which is, some people may deem it, the sign of a very virile and fertile woman. And you're able to breastfeed your 9-10 children. That's how it's been looked at traditionally.
okay.
So sometimes a lot of these women feel like, am I doing the right thing?
Oh no.
Yeah. But on the other side, the large breasts are causing them a lot of back pain,
Yeah.
migraine headaches,
I can imagine.
neck pain. They get rashes and infections
And,
underneath their
yeah.
breasts. And some of these women, and some even girls, because some of them started getting this at very young ages, like 12, 13, 14, and they struggle with it for a very long time.
Yeah.
The beauty about it is that it's one of the most rewarding procedures for the patient, because almost literally the next day
You're like-
they'll tell you, doc, I'm lighter,
Yeah.
my back pain, I'm able to stand up
Oh,
straight,
that's so good.
their migraines go, and, they're good and they're happy. Yeah,
That's so awesome.
yeah,
Cool.
yeah.
So you mentioned aesthetic surgery is not as popular in Kenya. But is there like some of it that because I've noticed like you'll see like billboards, you'll see like influencers post how like they got like tummy tucks and like Vera Sadika, and you're like
Yeah.
what is most popular?
All right, so the common ones would be liposuction.
So liposuction is removing from
Yeah, so liposuction is removing fat from areas where you don't want it. So we use a machine called a liposuction machine. Through a very small hole in your skin, we stick it through, and then the machine sucks the fat out.
Sounds
Okay.
so painful.
I prefer to call it body contouring.
Okay.
Because it's not just sucking fat out; it's removing it in the right places so that you can get the right kind of look. So that's fairly common. And then tummy tucks. Tummy tucks are
What is the
fairly.
difference between like removing
Yeah.
the fat and tucking?
All right. So with tummy tucks, it is more of open surgery. All right. So we're literally cutting out the lower section of your stomach
Yeah.
and redraping it. That's what we call it.
Redripping.
Redraping. You know, like
Redrape.
the way you can drape a curtain. Or we kind of like pull down
Oh,
whatever is left like that.
this.
Okay. And then tighten your core so that you get the little six pack
Interesting.
and, you know, the figure eight shape. So that's what a tummy tuck is. It's a different procedure.
Okay.
Now, that said, we sometimes do liposuction only. Sometimes we do tummy tucks only. Many times we do a combination of the two. Yes, so that you can get the right contours, because you may do a nice tummy tuck, but they still have issues up here that need to be addressed with a bit of liposuction, or on the back that need to be addressed by liposuction. So those are fairly common, the liposuction, the tummy tucks. Arm lifts are also very common.
What is that?
An arm lift. Arm lift is, you know, when sometimes people have a little bit of sagging skin.
Isn't it
over
normal?
there. Normal is a matter of perception and opinion.
Okay.
Technically, it is normal. It's
Yeah.
about whether you like it or not. Okay? So if you don't like it, there's a solution for it. All right? And once it is taken care of, patients are very happy.
Awesome.
Yeah. So it's called an arm lift.
Okay.
Yeah.
I'm kind of very challenged with this because, I mean, I don't know if you know, but, you know, I do Pilates. I am
Yeah.
into nutrition, wellness, like just taking care of yourself.
Yeah.
And some of these things like feel like very short term. Like, are people changing their lifestyles? Are you changing what you're eating? Are you changing like your exercise? Like, you know, you can get rid of like the fat hair by changing your exercises and, you know, working out. Is it like something short term? And how do you deal with that? Because you can do it, and then 3 months now you're going into like very unhealthy eating behaviors, like eating foods that will bring back the fat on. Just curious on your thoughts on that.
Okay. So I generally tend to see two kinds of patients. There are patients who have tried everything and it just quite hasn't worked for them.
Okay.
All right. So they've exercised and, you know, they're dieting well, but you find, for example, a lot of them, their bodies have just been ravaged by
All this
you know,
stuff.
the rigors of pregnancy, for example, and they may have lost weight, but losing weight doesn't translate to you having a nice physique or the physique that you would
wish.
want.
Yeah,
Because, for example, you could lose a lot of weight around your stomach, but you lose weight, but you still have saggy skin, because the saggy skin doesn't necessarily go away with
Probably after,
the weight
true.
loss. So they want that, you know.
Then I'm proud of mine.
Sorted out.
I'm like, it's because I've had a baby. I'm like, it's my Porsche.
Yeah. But the people who
This is
don't
like
like
they
it, so
wanted
they
to
have an option. Yeah.
No sign of it. Yeah.
Yeah, they want no sign of it.
Yeah.
So, you know, there's those kind of patients.
Yeah.
And so even once you're done doing the body contouring procedures, then I always tell my patients, look, I can do whatever I need to do.
Yeah.
But if you're not willing to, you know, invest a little bit more in your lifestyle, so I'm talking exercise and diet and wellness and all these things, I can only get you so far.
Yeah.
And for you to have results that you're going to be proud of 10 years down the line, you would need to make, like I said, an
Changes,
investment
yeah.
in yourself and change all these things.
Yeah.
And failure to do so, it's may lead to some inconsistencies in terms of what I left you with.
Yeah.
Okay, so I mean, I've done a tummy tuck, but 10 years later, if you haven't made the necessary lifestyle changes, then you'll be like, oh, doc, this has come back here, this has come back here a little. It can come back to some extent.
Yeah.
But by and large, most of the women, once they get their procedures done, especially like the tummy tucks and stuff, they're pretty happy.
Okay.
The second kind of patients are the ones who are looking for a quick fix. And again, I personally always take my time and look. I'm very honest with my patients and look, this is not a quick fix. It's not magic that I'm performing.
Yeah.
I'm not God.
Yeah.
You need to understand
Yeah.
that, like I said, I can only take you so far.
Yeah.
This can get you here. What I'd like you to do is A, B, C, D. So I'm not just giving them the tummy tuck, I'm advising them on what they need to do thereafter to get that going. So I would link them with people like nutritionists and the like. Or I also do have some patients who they've struggled with their weight. So I put them through a weight loss program.
Oh, okay.
All right. So, I tell them, look, commit 3 months, put you through a weight loss program. You shed off all the weight that you need to shed off when you get to the point where you're happy, and then let's talk about
it. Oh, that's good.
contouring
That's really good to know.
Things like that. So you also gauge their level of commitment towards this.
Kudos.
Yeah.
That's awesome.
Yeah, because people walking around with poorly done tummy tucks, that reflects badly on
the
me
doctor.
and the work that I do.
Yeah.
Yeah.
Just a question. I know I don't know what the name is, like plastic surgery on the vagina. What's it called? Does that fall under what the scope of work you do?
Yeah.
Oh my gosh. Okay.
Me,
I would judge everyone who came into if I was you online.
So we do a lot of work around the vagina.
What do you mean by that?
Yeah. We do a lot of work around the vagina.
So there are several procedures. So there are things like, it's called vaginoplasties.
Yeah.
Plasty just means plastic surgery related to that particular
So it's
area.
not a plastic vagina.
Yeah, no.
Okay.
So vaginoplasties, and then within that you have the labioplasties or the clitoroplasties.
Oh, wow.
You have things like G-spot augmentations. There's a whole bunch of stuff.
Wide world out
Yeah.
there. Jeez.
A lot of the work that I personally have done in that particular area has a lot to do on the reconstructive side.
Okay.
Because I have
So
patients.
mothers.
No, I have patients who've had FGM performed on them.
Oh.
Right? So that leaves a lot of destruction and a lot of just a huge loss of, what it means to be a woman, or what they feel that,
Yeah.
is important to them. So, they come in for work around the vagina. So it includes a combination of different procedures. So like, you have to give them back a clitoris. You have to repair their labia so that they have, you restore what they had before.
Okay.
It's not completely perfect, but, they end up very, very satisfied afterwards with the results of that, because a lot had been taken away from them. So you're just trying to bring them back. All right. So that's on the reconstructive end.
Okay.
On the cosmetic end, I honestly haven't had too many patients who.
But you've had a few.
Yeah, I mean, I've had a few. I've had a few who want like fuller labia. I want a more youthful looking vagina, so we give them that.
That's a fun job. I want a fuller looking vagina.
Yeah, it is. It's interesting work. There's also what we call the G-spot augmentation.
Talk to me. What is the G-spot augmentation?
G-spot augmentation. So, how do I put it? So the G-spot was this thing that was invented by, I believe he was a German doctor.
I thought it was a
couple
rap
of years
song.
back. I think it was in the 70s or something like that. So he stumbled upon this area in the vagina where there's this huge collection of nerves. And they then made the conclusion that this was the point where the women achieve stimulation, or which triggers orgasm and stuff like that. So it became known as the G-spot. Some people consider it an absolute mythical creature.
Oh, the G-spots.
Yeah, some people don't believe that
Okay.
a G-spot actually exists. But he pinpointed a specific area in the vagina. So it's such and such centimeters away from the vulva. This and this coordination, posterior part of the wall. That's where the G-spot is. So the procedure literally involves making that G-spot area a little bulkier. All right. When you make it a little bulkier, you increase the chance of that area being stimulated. And then you therefore, by extension, increase the chances of a woman achieving orgasm by doing so.
Yeah,
So
because
we
I think
do
there are
so.
women who don't
Yeah.
orgasm, and that's
Yeah.
okay.
There are.
So they come for that. That's like the core reason or the...
Yeah.
Okay.
So, yeah, they come for that and they're like, okay, doc, how can you help me out? And like, oh, okay, we can do this
Okay.
for you. So you either inject a little bit of fat around that area,
Wow.
or some people do what we call filler treatments, which is more of a synthetic thing that we just inject underneath the skin and it lifts it up.
And this is a once-off
Yeah.
type of... Okay.
Yeah, well, you can't get top-ups, especially if you use something like fat. Then, the fat over time kind of dissipates.
Yeah.
And you can come back for a top-up
Okay.
kind of thing. And also injecting things like fat or what we call platelet-rich plasma. I don't want to get too technical.
Yeah.
But they also improve nerve stimulation. So, again, they augment the G-spot.
Okay.
Yeah.
That's very interesting. And is there a known medical reason why the nerves in the G-spot may just become less, stimulated, if that's a word?
That's a good question.
Okay.
I'm not sure, but what I do know is that women attain orgasm in different ways.
Yeah.
Right? There are some who get it through clitoral stimulation, for
Yeah.
example. There are others who get it through
Penetration.
vaginal penetration. So, no two women are the same.
Okay.
Yeah. And of course, over time, some of those things may age.
Yeah.
Yeah.
Okay.
Or dry out. Yeah.
You exercise.
Yeah. And then, there's also because
Don't
of
know
course
why I'm laughing.
because of course also in the orgasm loop there's the bit that happens up in the mind,
Yeah. Okay.
which is also super important.
Okay.
Yeah. So again, there are things like, are you with the right partner?
Yeah. What's going on?
Yeah, you're not achieving the levels you would hope to achieve.
Okay.
Yeah, and for clarity, I am not an expert on
G-spots.
orgasms.
Oh,
and-
orgasms. And then let's not turn this into a sex podcast. You've mentioned a lot of women. Do men?
Do men get plastic
Yeah.
surgery? Funny enough, I was talking to my wife today morning about how women are the drivers of healthcare,
That's very true. Yeah.
right? In the sense that women would be the first people to tend to look for a doctor
Yeah.
or when they are sick,
Yeah.
or take their children to see the doctor.
Yeah.
And in many cases, drag their husbands or their boyfriends to go see the doctor.
Yeah.
Most times you'll find that you've been told by your mom or your girlfriend or your wife, you need to go see a doctor about this
That's-
thing, and then
yeah.
the men will come. Yes, men do get plastic surgery.
Okay.
It's not very, very common. More so in the West, a lot of them would go towards it because in the West the culture is very different. You have the whole celebrity thing. You have people wanting to look a certain way on social media.
Yeah.
So there are procedures, for example, like high definition liposuction, right? That gets done on men. So these would be people who've been gymming already, for example. But then you're going to act a certain role in a movie, and you just need that extra bit of definition.
Okay.
All right. So we come and then we carve you out properly.
Yeah.
Okay. Carve you out properly so that you look super lean and your muscles are very, very well defined.
Yeah.
So there are men who do that.
Yeah.
There are men who come in for nose jobs
Like the
as
nose
well.
jobs. Yeah.
Yeah, but again, those kind of men tend to be a bit of a red flag for us.
So really.
So you need to be very careful when a man walks into your clinic and wants a nose job.
Tell me more. Why? Why is it a red flag?
They're tricky patients because a lot of the time you'll find,
Yeah.
and this is something that's pretty well known within the plastic surgery community, fraternity,
Yeah.
and I believe it's even science-based, is that they tend to have very unreasonable expectations of what can be achieved, all right? And to some degree, they may also have a form of body dysmorphia.
Oh, okay.
Now, I'm not saying that a man who is unhappy with his nose shouldn't do something about it.
Yeah.
I'm just saying that we on our end have to be very, very careful
Okay.
with who we do procedures on.
Yeah.
Yeah, because as much as I can do it, we are really careful who we do procedures on at the same time. It's
Yeah.
not just a matter of doing as many as we can. It's
Yeah.
like, okay, is this the right particular patient for this particular procedure?
Okay.
So yeah, there are men who do come in for nose jobs, men who come in for liposuction. I've seen men come in for wanting bigger penises.
Oh yeah, I was actually going to ask that.
Yeah.
You do that?
I've seen it twice so far in my career.
Pause.
Like in Kenya.
Yeah, in Kenya.
Interesting.
Yeah,
Yeah.
in Kenya. So there are men who do want that.
And is it achievable? Is that something that
It's achievable. You can get, let me say, modest results with it. And by modest, I'm talking about maybe 1 or 2 inches on an erect penis.
Oh, okay.
But if you're moving from 3 inches erect, you're not going to get to 8, 9.
so there's people who want 8, 9
Yeah, well,
inches? Okay.
yeah. Yeah, so you have to kind of manage those expectations.
Yeah.
A lot of the other things that men come in for are, things that are around their face. Those they would come for.
Yeah.
So
I've
for
seen
example,
ones who
like
do
keloids and things like that.
And the
they
hair
come
thing.
in. The hair actually is extremely common with men. So hair restoration
Yeah,
and
yeah.
hair transplants, that's very common with men because of their hairlines.
Mm-hmm.
I have done Botox on men as well.
Oh wow.
Yeah,
Okay.
yeah, Botox on men.
But explain to me what Botox is, because I don't know what it is. Like
Yeah.
it's just injecting something and you can't smile. I see people who can't smile with done Botox. Like, why would you do that? I told you I could never have your job.
Wow. So, media has made it so hard to justify the things that we do and how we do it. Because a lot of the things that people have interacted with online are the bad side of it.
Oh,
So a lot
interesting.
of people have interacted with bad Botox.
Yeah.
All right. So, for example, I've had Botox.
Oh,
But
really?
I don't know if you'd be able to tell.
Where?
Because it's not bad Botox. I've had good Botox.
Where have you had
right?
it?
On my face.
Okay.
Right?
What is it?
It's currently wearing off. So what Botox is, it is it's a synthetic substance, right, that we inject into your muscle. It is actually cultured from a bacteria, and it paralyzes muscle. Okay, it has very many uses, but throughout the 80s and the 90s, people started using it cosmetically. Right?
Okay.
It was used cosmetically for anti-aging. Okay, so whenever
So
you
what
make,
was it originally used for?
it was originally it was found by accident.
Oh, okay.
It was the botulinum toxin. I can't remember what it was initially
Okay.
used for, but it was found completely by accident,
Yeah.
and people found that this thing paralyzes muscle, and then
Yeah.
it paralyzes muscle, and then somebody went and said, okay, so what muscles would we need to paralyze, and how can we make this a therapeutic thing? So of course, Big Pharma took it up and said, okay, we can use it for this. So they started manufacturing Botox, and it became very, very popular for anti-aging.
Okay.
So, for example, on your face, every single facial expression that you make is because of a muscle, moving a muscle. And our wrinkles come about because when you move that muscle, it kind of folds the skin.
Yeah.
So it's very simple. If you stop the muscle from working, then you stop folding the skin.
Yeah.
All right. So, for example, if I raise my brow, so my Botox has worn off, so you'll pardon me. If I raise my brow like that, that's because of
Yeah.
muscle.
Yeah.
Now, if I paralyze that muscle,
So
and
if
I
you
raise
raise
my
it,
brow,
you wouldn't.
yeah.
Okay.
Okay. So that's essentially what Botox does. So we usually do it in several areas. The most common areas are here in the middle. All right, the frown lines. And then we do it here on the sides. It's called the crow's feet. And we do it
On the forehead.
as
Okay.
well. Okay. Those are the on-label indications for it. You can use the other parts like lower down in the
smile lines.
mouth. You can use it on the neck. But yeah, there are several other uses for the Botox that are also non-clinical. So if you have patients who have what we call very spastic muscles.
Yeah.
For example, patients who have like cerebral palsy.
Yeah, yeah.
I'm sure you've seen
Or
those
stroke.
kids. Yeah.
Yeah.
And their limbs are literally caught
Yeah.
in like flexion or a contracture like that. You
Yeah.
can inject some Botox,
Botox,
in
yeah.
the muscle, and that
Helps.
will loosen and free it out.
Awesome.
Yeah. So a lot of what you've seen on the media is the bad Botox.
Yeah.
Okay. Because a lot of things can go wrong with Botox if you have the wrong person doing it.
Okay.
Yeah. And even right now, internationally, there is a move to do less and less.
Okay.
Yeah. So before plastic surgery, people were, let me do a lot. Okay. So let me get Botox, let me get all this stuff done on my face. Because people wanted to look different. So in the West, what ended up happening is because so many people were getting plastic surgery, they started looking the same. And then,
That's where Kenya's heading, right? No? The chicks
Yeah.
all kind of look the same. You're like,
yeah.
yeah.
So the celebrities are like, I look like everybody else.
Yeah.
So there's this whole trend of now for plastic surgery reversal. So you'll find a lot of
Oh,
people
whoa.
undoing what they
Jeez.
already had done. So if they had fillers on their lips, people are going to get those fillers removed, moving towards natural things. There's even a trend nowadays toward, it's called baby Botox, where you just inject very little amounts in certain areas of the face so you can get more subtle changes as opposed to a lot that they used to do before. Yeah.
I once heard of this concept, and this is like, well, I was in Australia, Botox parties.
Yeah.
Where, have you been?
Those are fun.
Oh, they happen here?
Yeah.
Oh,
Yeah.
what? Okay.
Yeah. Yeah. I have had requests for
A Botox party. Okay.
Yeah.
Do you accept those requests?
The conditions have to be right.
Okay.
Yeah.
Because sometimes they're drinking and getting like
Yeah.
their Botox done, which doesn't
Yeah.
sound very safe.
It's messy.
Yeah, yeah.
It's messy.
Yeah.
And at the end of the day, I'm a professional and I have to meet certain standards. So,
Okay.
Provided those standards can be met, then it's something that I would consider. A lot of the patients just come to the office. Yeah, I mean, if you're getting married in 3 weeks' time, just come 3 weeks, I'll get it done for you in my office. We don't have to do it during your bridal party.
Yeah.
Yeah.
Okay.
Yeah.
Gotcha. Cool. Are there any like misconceptions or myths around like plastic surgery that like you wanna talk about or?
Yeah, well, where do I start? It's a very, very misunderstood field.
Yeah.
I'll call it that. The biggest one that I get a lot is that, this thing is going to kill me. I'm going to die doing this procedure.
Yeah.
That's usually one of the biggest barriers we find to patients actually coming in for procedures, that they're going to die.
But it is major surgery, right?
It is.
Yeah. Okay.
And I always dress it up like this. I don't sugarcoat it because look, with any surgery, there's risk involved.
Yeah.
Now, with plastic surgery that is well done by the right person, in the right facility, under the right conditions, that risk is at a minimum.
Yeah.
It's very minimal. It's still there, but it's minimal. The problem usually comes in when people get these procedures done in places that do not meet those conditions.
Okay.
Okay, so there are places in Nairobi that you can get plastic surgery done by people who are not plastic surgeons.
Okay.
All right.
That's dangerous.
Yeah, because the average patient doesn't ask whether the person doing their procedure is a plastic surgeon. All right. They see a billboard and they're like, oh, okay, let me go here for my plastic surgery, and they see somebody sitting in front of them in scrubs, it's written doctor.
So they don't question. They don't ask.
Yeah. So
Oh gosh,
they don't
that
do
is
their
very
due
scary.
diligence. And sometimes that can have repercussions.
Yeah, for sure.
And also the facilities where they're having the procedures done. Are the theaters safe enough? Are they meeting the bare minimum conditions for sterility and things of that nature? The anesthesiologist, the person who is handling you, do they know what to do in the event of a crisis?
Yeah.
Okay. However, that said, even under the best conditions, it's possible that things can go wrong.
Yeah.
All right. Now, the reasons why you're in the hands of professionals is because a professional would know what to do in the event that something went wrong.
Yeah.
And you're able to manage the crisis. All right.
Yeah.
In the event that you do not go to somebody who is
Yeah,
a
they
professional,
don't know.
then they don't know what to do, because somebody can say they can do a liposuction, right? Because they've seen it on TV. Maybe they went and did a few or did it with someone. Like, oh, this is easy
On
enough.
YouTube.
Yeah. But when things go wrong, do they know what to do
Yeah.
in that situation. Yeah, and then again, sometimes there are things that we just can't control for, and those make up the very, very small percentage of things that can happen and that can go wrong.
Okay,
But
gotcha.
by and large, plastic surgery is safe.
Safe.
Yes.
Gotcha.
Yeah.
Anything else?
What other myths are there? I mean, very commonly people think, and I think I mentioned this earlier on, that plastic surgery is a substitute for weight loss. For example, it is not.
It's not.
It is complementary. And I always say this to my patients: it's complementary. If you're coming to me and you want a tummy tuck so that you can lose weight, I'll tell you, no, shh, slow down.
Yeah.
No. No. Mm-mm. Mm-mm. No. 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 Hell no. 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 I refuse. No. No.
Yeah.
My tummy tuck is not necessarily going to make you lose weight. I will shed off some weight,
Yeah.
but it's not going to make, I don't know, your arms thinner or your face thinner. It's just going to remove the fat from your lower abdomen. And
Yeah.
you could still end up being overweight or obese.
Yeah.
Despite that. So again, that's a common misconception about plastic surgery. Other very common misconceptions are things around scars, for example. That, okay, let me go to my plastic surgeon. I'll get the surgery done and there'll be absolutely no scarring that happens after that. That's absolutely false.
Wait, so there's scarring?
There's scarring.
Oh, really?
Yeah, there always is scarring. There's nobody who can guarantee that you're not going to have a scar.
Like even for like the tummy tucks and the...
Yeah. So what we do very well is give you the best possible scar that's barely noticeable.
Okay.
That's what we aim for.
Okay.
But there will be an element of a scar.
Yeah.
Yeah, it's not possible to completely restore your skin to where it used to be before it got an injury or a cut. There's going to be a scar.
Yeah.
All right. Now, the scars fall on different sides of the spectrum. You can have a horrible scar, or you can have an extremely good scar
Yeah.
that even if I'm standing here looking at you, I can't tell
Yeah.
that you had a cut on your forehead, for example.
Yeah.
All right. So that's what we do.
Okay.
Yes.
Cool.
Yeah.
I guess those are... I guess I have a question, some misconceptions.
Yeah.
I've had, I don't know, situations like when people get like boob jobs, there's like leaking and boobs exploding. Is that a myth? Is it?
It has happened.
Jesus! Oh my God!
And,
You
and it-
just
and
want
it's
and
spontaneously exploding. There's once I saw a clip that was doing the rounds of
Yeah.
a lady who was in an airplane, and the airplane, I think, was taxiing, and
Took off, and Connie could feel it. Her luck was changing. What she really felt was the stirring of air bubbles and other gases trapped in her new knockers. Her lovely lady at an alarming rate. They grew to ridiculous proportions.
going up high altitudes, and all of a sudden her breast started getting bigger and bigger. And no, that doesn't happen. That doesn't happen. It's very easy to sensationalize and make dramatic, ridiculous content around plastic surgery.
Yeah.
But no, those situations are not possible.
Okay.
Now, is it possible for you to have an implant and what we call the capsule
Yeah.
gets like a little perforation or something?
Yeah.
That is possible. That is possible. Now, like everything else, you see, these implants have undergone evolution. They're like a tech gadget.
Yeah,
Before we used to have phones that couldn't take photos.
Yeah.
Now we have phones that zoom times 10, or is it
Yeah.
times 150? So the same thing has evolved with implants. So initially they were using certain materials that over time they realized perhaps were not good, and they were getting higher complication rates from them. These days the materials are a lot better.
A lot better.
The situations in these days where we tend to see something like an implant busting is, for example, if you're in a road traffic accident and you have a seatbelt on,
okay.
with high impact, then that impact can affect your implant and it can poof. Or, I mean, if you've been stabbed, you're going to bust.
Yeah.
Those are the situations where that tends to happen. Yeah,
But is
it's
it
not
harmful
a
to your
common
body?
complication.
Like if it leaks and you
if
didn't
it
know?
leaks, it's absolutely safe.
It's safe,
because the
okay.
contents of
Yeah.
the implant are something that's not harmful to
your
your
body.
So
Yeah.
they're designed with that in mind. If
Okay.
the worst was to possibly happen, then the patient is still safe. That said, if your implant busts, please
Go see a doctor. For sure.
Yeah.
I was going to ask you if you've had plastic surgery yourself, like if you've done any work on yourself, but it sounds like you've done Botox.
No, yeah. Other than the Botox, I haven't had work done on myself.
Yeah.
And even the Botox, I did it during. We got together a bunch of people in aesthetic surgery, and we were doing a workshop actually on Botox.
Hey, your workshop's interesting.
Yeah, and during the workshop, like somebody has to volunteer. Like, oh, okay, so let's do a demo. Like, who wants Botox? And of course, everybody puts up their hand. Like,
Yeah.
I mean, if I sat here and gave you guys free Botox, chances are you'd say, oh, let me onja kidogo.
Ulisikia wapi? Ulisikia wapi?
I don't know.
Yeah, so those were the situations in which I had it done.
Okay.
Because also, it's easier to sell or convince a patient to do something or guide them on how something works when you've done it yourself.
Yeah.
Yeah. So I mean, I can't walk around doing tummy tucks and boob jobs, but Botox seems like a low enough hanging fruit
Yeah.
with minimal risk. So yeah, I had done Botox. I think it was probably about. It's wearing off now. It's worn off, almost completely worn off now. So that was probably about 4 or 5 months ago.
Wow, it takes that long to.
Yeah.
That's impressive.
Yeah. But would I do it again? Yeah, I would. Yeah. 'Cause I liked the results.
What results? Like you look the same when
My
you.
skin was glowing.
Your skin was glowing.
Younger.
Are people giving
I
you
got home and
compliments?
my wife was like, it's something different.
Something
And I had to
different.
like, what's going on? Your skin is really, it's giving.
Oh, so interesting.
And I'm like, yeah, I got my Botox.
Oh, cool.
It's like, yeah, even me, I want. Can you do for me? And I'm like, yeah, okay.
Okay.
Yeah. But I'll
Interesting.
charge you.
Interesting.
Yeah.
Where is like sometimes I feel like coming out of like plastic surgery, sometimes I feel like the medical space is a bit slow to adapt to like changes and technology and what are some of the trends you can even talk about like plastic surgery that you are seeing in the space?
Yeah, I mean, you're absolutely right. It's something that I've struggled with myself, having a lot probably younger blood than my older colleagues, and trying to just get things changing and moving. Like the better ways we can do, all these things. Medicine traditionally it's one of the oldest professions.
Yeah.
And a lot of the practices within it have been based on science and scientific fact.
Yeah.
Because the problem with medicine is that your failure to comply to certain norms can end up catastrophically for a particular patient.
Yeah.
So that's why it tends to be guarded a lot more to new things coming in. So we don't just welcome everything that's new. Everything that's new that's coming in has to be backed by a reasonable amount of science
and research. Yeah.
research and data. However, even when it is, the adaptation can still also be slow. Because if it starts up in the food chain by people who are older, they'll be like, well, I've been doing this this way for
50 years.
Yeah, I'm not about to change it. You can't teach an old dog new tricks kind of thing.
Yeah.
And sometimes if you then leave it to the younger people to pick up all these newer things, and one thing goes wrong,
Yeah,
and
it's
then like, see,
this
we told
is
you.
these young people. Yeah.
These young people are doing their own things. So, I mean, in my opinion, the onus is literally just on the younger generation to just get things moving. The problem is the younger generation have been inculcated by the older generation and there's very little freedom for thinking within medicine sometimes. So unless you're willing to take,
and you guys are that smart. And
and that's something that has really let me say bothered me for a very long time.
Imagine.
These super smart guys who are just indoctrinated and inculcated, like, can we do this a different way? Can we figure out a different way to do things?
Yeah.
Yeah.
Are you doing anything a different way?
Yes. I'm trying to. So a couple of years ago, I sat down with a bunch of friends and At that point, I remember I've dabbled in a lot of things. So one of them was this 3D printing thing.
Yeah, yeah.
A lot of the work that we've done so far has been completely pro bono, to just give patients access to the cutting edge technology and not make it such a distant cry or something that they only hear of or see of on television.
When the case of the conjoined twins presented, a 50-strong multidisciplinary team of doctors were faced with the challenging task of conducting the operation at the Kenyatta National Hospital in Nairobi, and the introduction of 3D cast bridged that gap.
We had never had a case that was as complex in terms of the surgery alone and everything surrounding the patient. So this presented a challenge to the entire team, because this is the one that we had to get right. What we have is the two children sitting back to back, so to speak, joined in the center. And we're then able to use this particular cast, even intraoperatively as we're operating on the twins, to guide us, to use it as what we call a surgical guide.
The doctors performed the surgery for 23 hours.
The priority was, of course, one was to preserve the lives of both the children, and two was to ensure that after the surgery, even it being a successful surgery, we had to make sure that the twins were able to walk at the end of the day.
After the successful separation of the conjoined twins, the use of 3D printing technology under the team, a prestigious publication in the Journal of Pediatric Surgery case reports.
We see a place or a point at which every hospital in the country, public and private, does have an in-house 3D printer with 3D printing technicians or people experienced in the field to be able to generate these kind of models to improve the care, the quality of care across the board for these kind of patients. So I started messing around with 3D printing and looking at 3D printing in medicine and what we can use it for.
Yeah.
And things move pretty fast, because I read about it a little bit. I saw, okay, what do we have in Kenya? What can we do? And I remember one time I was sitting in a lecture and they were talking about this patient who needed such and stuff. And I was like, and they talked about, okay, it would be useful if we had a 3D print for this thing. And at that point, I hadn't done any 3D printing to that point, but I had read a lot about it. And put up my hand. Like, I can get you a 3D print. They're like, oh, okay. Are you sure? And I'm like, yeah, I'm sure. Then they're like, okay. This was on, I think, a Wednesday. And they're like, okay, so you bring it to us on Monday. I'm like, Monday? I had no idea where I'm getting any of this stuff done.
Oh, wow.
So anyway, I had to move quickly.
Yeah.
And eventually found out a lot of people in the space who were already doing some stuff with it. And long story short, I managed to deliver it by that Monday.
Oh, wow.
And then
Got
I
you.
realized, oh, okay. But I used my own money for it, obviously. But it was so useful and added so much value to that particular situation that I then got together with a friend of mine and decided, okay, let's start a business. Like, we don't know where this thing could be a couple of years from now. So let's just start up a business. So when we're starting up the business and trying to innovate and bring in this new product, we realized that, one, the medical space, there was very little support. Everybody was so siloed, especially the startup world. There was nowhere where people were coming together and sharing and doing all these things. We were like, what is going on here?
Yeah.
So having experienced that problem, it led us to trying to solve a different problem in terms of how siloed the medical profession is.
Yeah.
And how little innovation is happening within it, or at least we thought there was little innovation happening within it. Or if there was innovation happening within it, nobody was having these conversations of where all this innovation can link together.
Yeah.
So we then started creating this network of doctors. So we literally started hosting events.
Oh, nice.
We would put a bunch of people in a room, and the topic was not science-based. The topic wasn't, what's the latest management for an appendix? No, it was like taking 3-4 different people from different spheres or different startups within the medical space, putting them on a platform like this and talking.
Oh, nice.
Right? And we realized that we drew a crowd of people to that. And we slowly ended up building a following of doctors. And then we were like, okay, so what next?
Yeah.
All right, what do we do with these doctors? So we said, okay, let's not guess what these doctors want. Let's just ask them.
Yeah.
So we took them in little bits and batches, and put them in a room and told them, you guys, what do you want? And we listened to them, we did questionnaires, we showed slides of different things, and eventually concluded that we needed to put, a lot of these guys were young people between the ages of 25 and at the time 35 or so, and we listened to all their pain points and came up with the top 3 things that we felt would be able to address these pain points. And we eventually embarked on putting together a co-working space
Oh, nice.
for a lot of these doctors and young professionals to start off. Because in the medical field, for example, if I had started my trajectory without that support, then it would take me a longer time to get further ahead in the profession. Because when you come out as a specialist, and you need a place to start seeing your patients.
Yeah.
Right? It's expensive to set up a clinic. It's expensive to hire staff for the clinic. It's difficult to get things like insurances on board, and you know
Oh, really?
that
Okay.
whole
Process.
mess.
Yeah.
And there was also a generational shift because a lot of the young doctors, they don't want to do that. They don't want to be involved in the day-to-day, knowing how much the steamer bill is,
Yeah, yeah,
or
yeah.
how much the rent is,
Yeah.
or chasing business permits in town. No, they just want a place where they can see their patients and
yeah.
live. So we ended up creating that solution for them, and still maintaining the same network
Oh, nice.
of doctors. Initially, it was supposed to be for clinical and non-clinical things.
Okay.
So the vision had been to have, can I have, for example, a neurosurgeon seeing patients on this wing,
Yeah.
but a startup developing the next best thing in med tech
Yeah,
on this
yeah.
other side. And then can I have a room in the middle of all that where these people can meet?
Yeah.
Where the neurosurgeon can sit down with this tech guy and tell them, you know what? Maybe you should think of doing it this way.
Yeah, that's so cool.
Yeah.
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 That is really cool. Yeah, good
Yeah.
luck with that. We'll be watching that closely.
Yeah.
Yeah.
And we hope it goes somewhere. It's our little baby, so
Yeah,
to speak.
yeah, that
Yeah.
really makes sense. Changing gears into something a bit controversial. What's your
Yeah.
take on sex changes, where someone feels that they are not the sex, like I'm a chick and I want to be a guy?
Okay. That's a very, very broad subject.
Okay.
I'll start with a story.
Okay.
So I have a colleague. He's older. So he's not grown up in this whole millennial and Gen Z mess that we're in right now.
Yeah, for sure. Lucky him.
So he's a bit more, how do I say, traditional
And conservative, yeah.
and conservative, very well established, a maverick, fantastic surgeon. So he got approached by an adult who wanted to change their gender. All right. Let me stick to very general terms.
Okay.
So that I'm not sure where I'm not using the terms correctly. But you will forgive me if I do.
I forgive you. I don't even, I know just basic sciences, male and female.
Yeah.
And yeah.
So the patient approached him and like, "Oh, can you do the surgery?"
So this was a man? Male?
Yeah.
Okay.
This was a male who wanted to transition to
A,
a woman,
a woman.
right? Now it's not that the surgeon didn't have the ability to do the surgery, but they were conflicted on a moral level based on their own belief systems
Yeah.
of what a man and a woman should be.
Yeah.
So they politely declined to perform the surgery. And look, I'm probably not the best person for you. Maybe you should, try seek it somewhere else, which is fair enough.
Yeah, yeah.
But I asked him, why? Why would that stop you? Because me in my head,
Yeah.
you're a professional trained in a particular skill.
Yeah.
So your beliefs shouldn't really muddy the waters. Like, you shouldn't have to get to that. Like, are
Yeah.
you able to deliver what it is that this patient wants? If the answer is yes, and you're able to deliver it safely, then go ahead, provided that the patient knows what it is that they're getting themselves into, and that you are able to deliver the outcome or the result. So I kind of had that back and forth with him. Now, that was his experience, all right? My feelings were, look, if you can't do it, go ahead.
Oh, okay.
But again, I wasn't him, and I wasn't in that situation. So would I act differently in another situation, in the same situation presented itself to me? I don't know.
You don't know, yeah.
I don't know. I would have to cross that bridge when I get there.
Okay.
It's not a surgery that I would be comfortable performing based on just a skill level kind of thing, because it's very complex.
Yeah.
Yeah.
Because I think
Yeah.
you need to bring in other specialists in, like,
Yeah.
it's a lot
definitely.
being a woman.
It's a lot.
It's like there's hormones, it's
Yeah.
just all this
Yeah.
stuff, yeah.
But under the correct guidance, would I love to be a participant in that whole process
Okay, I
and
got
learn
you.
how to do it?
not?
100% so.
It's a learning
Yeah.
experience for you.
Yes.
Okay.
Also, no, I was going to mention as well. So, again, there's a different side of it, of what we call gender reassignment. Okay?
What is that?
Which is a bit more of a more sensitive issue, because there are children who are born with ambiguous genitalia.
Okay. I get
Okay.
that, yeah.
Yeah.
Yeah,
So they may be outwardly male, or they may be outwardly female, or rather they have a mix of the two, right? So
How does that look like?
you know what? You can join med school, and then
It's okay. I'll Google.
and then we'll show you somewhere along the way. So there are a lot of difficult decisions that need to be made.
Yeah.
Okay. Now, a lot of those decisions are made on what sometimes you physically see. For example, if surgically it is easier for this person to be male, then we would probably then be best to assign this child a male gender,
Yeah, makes sense.
right?
Yeah.
So you do, or you plan for, the hormones and the surgery towards making the child male, because it could surgically be easier to do so,
Okay.
or more feasible to do so. And then you then assign the gender, which is a completely different aspect, okay, which is how you then raise the child. There's a difference between how you raise a female and how you raise a male.
Yeah.
So that's now, at that point, now you assign the gender. Now, the reason this has been so controversial is because in the past, patients have gotten to the age of 18 and they were like, hey, who told you guys me I wanted to be a man?
Yeah, I can imagine.
Yeah, I wanted to be, female.
Yeah.
So it's a very tricky area. So, and there are specific hospitals that handle these kind of surgeries. I'm by no means an authority on this particular subject.
Okay.
But all I will say, it is not as black and white as
can
we
imagine.
are made to believe, or even a lot of the back and forth that I see happening on social media and all these places. Like, there's a lot that you may not know about a particular person, and it's very important to treat those situations with a little bit of sensitivity, especially if you do not know or understand the facts.
Yeah.
Yeah.
So is it usually, and what's the term for it? Like people who are born with both? Is that medical term, right?
So the medical term is disorders of sexual development, or DSDs for short.
Hey, I
Though-
may know another one. Yeah.
Yeah, I mean, the terms have changed over time.
Oh, they've
so
changed.
they become more, how do I say, palatable with time.
Okay.
Yeah, because in the past, and even still today, you'll find people talking about ambiguous genitalia or unacceptable terms these days. Like, let me not mention them. But they're terms that were previously used before that, have evolved over time. Right now, they're just classified under disorders of sexual development.
Or disorder. Okay.
Yeah.
So usually, is it doctor's advice to fix it at that point when the child's very young because they've been born with it, or can you just wait and then they decide at 18?
So look, the doctor can only give input to a certain point.
Yeah, yeah.
Right? We can tell you that, look, this is what we think should be the
Yeah.
best course of action. But it is such a sensitive situation
Yeah.
that you have to involve the parent and the caretaker and
Yeah.
unfortunately put that burden on them in terms of what they want for this child. Because at the end of the day, they're the primary caregivers. They are the ones who are the custodians and the guardians of these children. So they eventually have to sign off and decide. At some point, you also have to get lawyers involved and
Oh, wow.
all those kind of things.
It sounds like a lot.
It's extremely complicated.
Yeah.
It's extremely complicated.
Okay, cool. Also around like sometimes the unrealistic expectations that come with
Yeah.
like plastic surgery, like there, and I think it affects women more than men. Where there's just unrealistic beauty standards.
Yeah.
I give a good example, the Kardashians. You know,
Yeah.
one day she's pushing for the voluptuous, like slim waist, big hips, big booty. Then the next she's like super skinny. What are your thoughts around that?
Look, personally, the way I approach it is, some patients would walk into the office, and they'll show you a picture on their phone and like,
Mi nataka
Doc,
kuona,
mi
I
nataka
want to
hii.
look like
Nataka
this,
kama hii.
like a dress.
and I tell them, put that thing away first. Let's have a conversation.
Oh, yeah.
Like, let's talk. And I really get them to the core of what their problem is and what they would like addressed, and keep them focused on that. All right? Because it's not possible for me to deliver them somebody else's results.
Yeah, it's not.
Yeah.
yet.
So I take my time as much as possible to help them understand and appreciate their individuality and their own uniqueness. Now,
Hey,
That-
so it sounds like you have to also do some therapy. Or
well, the therapy bit does come in.
Okay.
Okay. I'm by no means a therapist.
Of course,
Right? What I do know is what I can deliver for you and what I cannot.
Yeah.
Right. And if you come in wanting to look like Kim Kardashian, I'll tell you I'm the wrong surgeon for you. I'm sorry. Go look for Kim's surgeon.
Yeah.
Right. But once you understand what it is specifically that you want, then I tell you, okay, we've gotten to the crux of it, what you actually want, and you want your nose to project out X amount. I'll tell you, okay, we may not be able to get X amount, but I can get you to here. Is that something that you're comfortable with? Is that something that you want? All right.
Yeah.
And even once I'm able to get you there, you have to understand that the results can change over time.
Yeah.
For example, so you need to be very, very comfortable with whatever it is that you get. Yeah.
Okay. Do you have any like horror stories of they had these expectations versus reality? And it's not to say you've like done a bad job, but like
Yeah.
they just like wanted. Like I'm not yet seen it. So I don't know. It looks like very similar.
Fortunately for me so far, I've been able to dodge a lot of bullets.
Oh, that's good.
I've been able to dodge a lot of bullets just because of how my practice is set up. All right. So it is not a rush to get you on the operating table and do what it is. I am not a mercenary for hire.
Yeah. Okay.
I'm a professional.
Yeah. It's like
So-
that.
So if I feel that your expectation is ridiculous,
Yeah.
then I will tell you, you know what? I can only do this for you, right? And if you want what it is that you're speaking about, then I have to refer you to somebody
Someone-
else,
okay.
unfortunately.
Okay.
There are patients have done that too, and they have gone to other surgeons, all right, sometimes even out of the country, and they've come back with terrible results
Oh no.
or and had very, very bad experiences. So how do I say? I try and insulate myself as much as possible
As you should.
from those. There are some patients that I feel would require a psychological evaluation. Then I send them for the same.
Okay.
Because there are categories of patients who have what we call body dysmorphia.
Yeah.
and we're trained on, what to look out for.
And what is body dysmorphia?
So, body dysmorphia is essentially a grossly inaccurate perception of what it is that you look like. Okay? So, a person may look in the mirror and think they look like, I don't know, those slippers over there. They don't.
Yeah.
Or they'll say, my nose looks a certain way. But realistically, it doesn't.
Yeah.
And the problem with these patients, or where they end up, is it doesn't matter what you do for them. They will always feel they do not look like what they want to look like.
Okay.
All right. So they have an unrealistic expectation, and an expectation that is impossible to meet, regardless of what you do. Okay. So they may have a defect, some part of their body that you're able to correct. But the moment you correct it, and you've done a fantastic job, and you can put that patient in front of 1,000 people, and they'll tell you, oh, excellent. They will go and look in the mirror and say, no.
Oh, jeez.
Yeah, more, let's do this. Or they will jump from one body part to the other. So they'll say, it's very unlikely that you'll dislike your stomach, your breasts, your arms, your nose, your hair, your face.
Your toes.
Yeah, every single part of your body. You can probably figure out one or two things. I mean, everybody in all likelihood does have one or two things that they don't necessarily like about themselves. Some people are willing to live with it.
Yeah.
Some people are not. Some people are not, and you can never satisfy them regardless of how much it is you work on those situations for them.
Okay.
So we need to be very cautious in terms of who we then clear for surgery.
Okay.
Yeah. However, if you're a mercenary for hire, you will operate on anything as long as they breathe and has a credit card. Yeah.
Cool.
Yeah.
Do people get addicted to surgery, plastic surgery? I'd imagine you do this, you're like, oh, you look nice. You're like, I could do this.
Yeah.
Yeah.
I wouldn't say addicted.
Yeah.
There are some people after the first surgery, they have amazing results and they look really good. And even you look and say like, wow.
Yeah.
And they're like, okay, doc, this was fantastic. Can we sort this one out as well? And you go and you sort it out, and you go the next one, you sort it out.
Yeah.
They're not being unreasonable.
Yeah.
They do have problems that they would like addressed, and legitimate problems that they would like addressed. And they have a few surgeries, and they're not, I wouldn't say that they're addicted. I would just say they appreciate what it is that they got from the first one, and would like to replicate that somewhere else.
Okay.
There are patients who do get addicted, and a lot of those tend to be the patients with the body dysmorphia that I just described to you about.
Wow, I'm so proud of you.
From a baby to
so grown up. You're telling me about all this stuff. It's been like totally amazing. I think before we talked, like you've opened my mind. Like I think I'll be just kinda to like people who are going and people who decide to go through it. I'm sure there are reasons, but it's been amazing. Do you have any like last like parting shots?
No, I really hoped Malaika would join us the podcast so I can ask her what Dogo plastic surgery looks like, what she doesn't like about herself.
Yeah, her tail. Almost like we need to get your tail.
Yeah, but other than that, no, and I really appreciate you having me on here.
Awesome.
So that we can speak.
Yeah.
And tell our stories. We're a very, very misunderstood bunch of people out here.
Yeah, I can imagine.
Yeah, and a lot of our good stories do not make it to see the light.
Yeah, true. And I'm like, it's JP. JP can't be like doing this for any other reasons. Let me call him on set and we talk about it. But thank you.
Thank you.
So there you go. I found that conversation very interesting around the career of like plastic surgery. Please make sure you comment, share, subscribe, and if you need any like work done, it's okay. You know a guy now. Cheers. Bye.
9 to 5.